All right, everybody, welcome back to the DIEP End podcast. This is a really special day for many, many reasons. My name is Saïd Azoury.
I'm Hank Davis.
And we're joined by Dr. Jesse Taylor. Dr. Jesse Taylor is the Peter Randall Endowed Chief of the Division of Plastic Surgery at the Children's Hospital of Philadelphia. And he's the Everett Koop Endowed Surgeon-in-Chief at the Children's Hospital of Philadelphia. That is a new appointment, so congratulations.
Congratulations.
Before we dive into the podcast, I just want to tell you personally how much you've meant to my career. If you don't recall, I remember interviewing with you, and you were interviewing with Suhail Kuntwala. And my interview with you was just so special on the day of plastic surgery interviews that when I left the room, I was like, this place is for me. So I've looked up to you for a number of years, and because we had a similar training path back at Hopkins, and you happen to be our second DIEP End recording.
So it's been a while since then. We've stepped up our game a lot since then too. But
you guys look great. You haven't aged a day, you know.
And we're just so honored to have you here again for a second time. We're really excited for this.
Yeah.
Well, it's a huge honor for me to be back, guys, and I've been following your stories, and it's a mutual admiration society, Saïd. So
thanks so much.
I'm really proud of the work you guys are doing, and it's great to see, obviously, your recent award, Saïd, being named an up and coming leader in plastic surgery. Well deserved.
Thank you. You know, one of the things that always fascinates Hank and I, and, you know, we've had these discussions a little bit in the past, but to be honest with you, I don't think I know this much about you to know your childhood years. And was becoming a chair at CHOP always part of the plan from when you were a toddler? So tell us a little bit about kind of your path to medicine, your early childhood years, and what kind of shaped you through what we know, especially with you dealing with kids. We know that those years early on are very, you know, they really guide your path.
Yeah, so I grew up in Middle America mostly. Actually, my father was a cardiology and internal medicine resident at Hopkins. So I grew up in the shadows of the dome as a young boy, but we left Baltimore when I was 4. Moved to Charlottesville, Virginia for a couple of years, but I mostly grew up in Springfield, Illinois, where my dad was a cardiologist, my mom's a musician, and growing up, music was a big part of my life. Sports were a big part of my life. I have 2 brothers, a really close-knit, extended family too. Lots of our vacation time would be spent visiting other family members around the country.
One brother is here.
Right. So my younger brother, Luke, is on the faculty at Wharton. He runs their finance PhD program.
That's amazing.
So he lives right here in West Philly. So I get to see him, his wife, and their 3 kids frequently.
That's so awesome.
And then my older brother and his wife, until very recently, were in Washington, D.C., and they have 2 grown kids who have kind of been spread to the winds. But anyway, very close-knit family, Middle America, probably, you know, kind of classic family values. My dad worked really, really hard. He wasn't home for dinner most nights. He was working most nights. So
and he was Hopkins trained?
He was a Hopkins trained cardiologist, was briefly on the faculty at UVA. And then he and 2 other guys started a private practice in Springfield, Illinois. They were the first guys to start. He did the first heart catheterization in the state of Illinois.
Cool.
And they grew a practice from essentially nothing to 120 cardiologists and 12 heart surgeons by the time he left. So just watching him with his entrepreneurial spirit, and they actually had a funded, NIH-funded lab in their private practice.
Wow. That's
so kind of an atypical private practice environment. But anyway, just seeing, maybe learning a little bit about the work ethic of someone who's just totally passionate about what they do from him. And equally passionate, I think, was my mom about her music. And she taught music in our home as we were growing up. And at one point, she was like the choir director at my school.
Wow.
So I'd be like, hey, Mom, don't fail the mean kids. Don't. So anyway, I would characterize my childhood as fairly idyllic. like every family, we had our share of challenges, but I feel like when we would meet a challenge, we'd often become closer as a family, not further apart. So anyway, one of my first jobs growing up was actually working as a sort of in the operating room at a hospital, working on surgeon preference cards and trying to automate those from literally note cards to something that was computerized, and working on the taxonomy of that, et cetera. And I think I was a sophomore in high school. And my sort of supervisor would always say, look, if you get this amount of work done, I don't care what time you get it done, you can go observe in the operating room. And so I was usually able to finish that amount of work by like 11 or 12 in the morning, and then I would put scrubs on and I would go watch surgery.
That's so cool.
And, you know, back in the day, this was in Springfield, Illinois. So Springfield's the capital of Illinois, right in the middle of the state, you know, but frankly, in the middle of nowhere other than that. And so I would go watch surgery.
What kind of surgeries?
Everything. I mean, literally, I could take my pick, and you know, I'd see cardiac stuff. You know, these folks who I'd known growing up, I'd watch them do surgery, and then I saw a lot of ortho that summer, some ENT, some general surgery. I mean, it was truly like a little bit of everything, and it kind of got me thinking a little bit about, oh, maybe this would be a career I would be interested in.
Did your dad want you to go into cardiology?
No. And in fact, my dad and mom both always said, choose your own adventure. This isn't about us. It's about you, to my brothers and me. And I'm the only one of my brothers who went into medicine. It was never a, hey, you know, think about this, or in guiding us towards a particular path.
Were you ever thinking about cardiothoracic surgery? Because it's a recurring theme on our podcast. Every few episodes, a plastic surgeon says, you know, I was going cardiac surgery and then I ended up going into plastic surgery.
Yeah, I was one of those folks who was like, my dad had a reasonable career in this, and I wouldn't want to take on something where I would have the always comparing myself to him kind of thing.
Sense.
So I shied away from cardiology. In fact, when I was a third-year medical student at Vanderbilt, they had us take this like personality test to see what we would be well matched for, and it was it was like a 200-question test, and it was like a full day where we took the test, and they matched us with this. It was like some psychometric testing, et cetera, and it was actually that test which. My number one match was plastic surgery.
No way.
My number two was cardiology, which really surprised me because my whole medical school career, I was thinking something surgical. And I had spent a lot of time with surgeons. And so I had sort of decided on surgery, and I had tried all the different subspecialties except for plastics. And it was after doing that sort of psychometric testing that I started checking out plastics.
What do you think in the test pointed you towards plastics?
It's a good question. I mean, I remember there were a lot of questions about, you know, do you want to go in the middle of the night with your alcohol, or is it, you know, what are your salary expectations, and do you like to work with your hands or not? And so, do you like creativity or you know, rote memorization, and so there were a lot of those type. But it was like 200 questions, and so I remember. After taking that, it was a full day thing. It was about 5 o'clock. I thought, I'm going to go to the library and I'm going to look at several large plastic surgery textbooks because I hadn't given the plastics a try.
Just based off of that
Based on that test. And I started reading those textbooks, and I spent that evening in the library. This is back when people still went to libraries, reading, you know, books and looking at what's the subject matter here. And then I just happened to be on my OB-GYN rotation at the time. And literally the next day, I happened to be in a big pelvic exent with the OB-GYN folks, the gyn-onc folks, and then I stayed for the reconstructive part. And then the day after that, there was nothing going on in the OR. And so I went and saw them do a cleft lip repair. And after I saw that, I said, I think that's kind of what I might want to do in life.
That's awesome.
The cleft lip specifically?
Well, I think cleft is an entree for so many medical students into plastic surgery, and it really is such a, it combines complex geometry, three-dimensional thinking. It's a reconstructive procedure with really profound impact on a person's life. So I think for lots of students, and it's obviously a common problem, so it's a lot of students' entree into plastic surgery. And I think, the pelvic exent in reconstruction and then the cleft, I thought, okay, this is, the old head to toe, birth to death, the whole continuum that so many plastic surgeons talk about, and is, just kind of how I got into it too.
It's so interesting how little things like can change your whole trajectory in life, like a test like that.
Maybe we should
at
do
my
that
medical
more.
student, at my medical school, there wasn't a integrated plastic surgery residency, so it wasn't like it is here at Penn, where just so easy for students to get involved in plastic surgery. At Vanderbilt, it was a little more challenging at the time.
So then obviously you go into plastic surgery. Where on your training, I know you started off loving it because of cleft palates and cleft lips, but where do you decide, craniofacial is where I need to be in pediatric plastic surgery?
Hopkins at the time was very strong in cleft and craniofacial surgery. And then I would say our other our big strength was micro. And I really thought I was going to do micro actually for a long time. And I went to the micro meeting for many years.
I heard about this. Yeah. That's how you knew all the guys.
I loved it. And I still find microsurgery technically very interesting.
It's funny because even Dr. Cerletti credits his time there as a fellow for a lot of the micro he learned.
Yeah.
As a craniofacial fellow.
Yeah, and there was just so much, between shock trauma and Hopkins, there was just a ton of micro being done, and a lot of, back in the day that as a resident, you were doing, directing, I think, the patient care to a significant degree. So anyway, those were the two things that I think were most interesting to me. And as I was, again, trying to envision how I would spend my time in my career and the types of patients I would spend my time with, I gravitated towards taking care of kids with craniofacial problems.
Hopkins is a very, very, very special place. And every time I see Paul Manson, I think of you. And it's funny because I remember meeting with him in his office to kind of go over my rank list in plastic surgery, and I finally get to Penn, and he mentions that you and Dr. Cerletti are here, and I have to come to Penn, is basically how he phrased it. But looking back to those years, obviously there's him, a number of other people. What kind of mentors, not necessarily the individual people, because I know you have innumerable mentors, but like what sort of qualities sort of shaped how you were and what you became?
Yeah, it's, a lot of great mentors during residency. I could name, and it's interesting, a lot of the faculty have moved on, but, Craig Vanderkolk, Rick Redette, who's now a dean at Hopkins, Naveen Singh, Mo Nahabedian, who's had an illustrious career. But these are folks that I spent a lot of time with I felt like they took an interest in me, which meant a lot to me. Mentorship is something I've thought a lot about. It's something that I really treasure and that I seek out. And I think at every stage, really, I feel so strongly about having mentors now. And I was just with one of my mentors, Scott Adzick, before coming over here, talking through a challenging problem. And I think at every stage in life, we have people who we're teaching.
Yeah.
We have peers that we're maybe at the same sort of place in life with, and then we have mentors. And I don't know that ever ends. I hope it never ends. I get a lot of energy from being a mentee, actually, and mentoring others. And I think it's that cycle of life. And, other people, Joe Cerletti's been a huge mentor to me, Scott Bartlett, Linton Whitaker. And, Linton really took me under his wing when I came to Philadelphia in a way that was very special. And I do have to credit Joe Cerletti a little bit for this, in that he set this up where Linton and I saw patients together for 6 months as he was
incredible.
Transitioning out of practice. And so we did surgery together and we saw patients together. and developed an incredibly close relationship because of that really, persisted until he passed away earlier this year.
Yeah, that is really mentorship, to be able to set somebody up like you in that position.
Yeah.
And you've talked a little bit about Dr. Whitaker and Dr. Adzick and how important that is, and I think it shows a lot of respect for those who came before you. Like, he was a former chair of surgery here at CHOP.
Yeah.
And just similar to Dr. Saletti and Dr. Whitaker's position, where Dr. Saletti had utmost respect for Dr. Whitaker even after taking on his position. So it's a really nice giving back mentor-mentee relationship.
Yeah. And so much of what we learn in life is by watching what people do and sometimes wanting to pattern that.
Yeah.
And sometimes wanting not to pattern
yes.
certain things. But from Joe, it's definitely more of the former. I've watched Joe, obviously we've had a very, very close relationship over the last 20 years. And I've watched how he managed that relationship with Linton, how he interacts nationally on the plastic surgery scene, et cetera. So certainly I've just learned so much from him, and I continue to learn a lot from Joe.
Yeah. So two things I want to hit on. Number one, Mexico City. Right. What impactful, I've talked to you a little bit about this in the operating room and stuff like that, but what an impactful year that must have been.
Yeah. So, it goes back to Paul Manson. Paul Manson said, I said, well, I'd like to do craniofacial fellowship. He goes, okay, where do you want to do it? I said, well, I'm up for going anywhere in the world.
Were you married with kids?
I was not married. I was dating my now wife at the time, but we were not married. And he said, anywhere in the world? I said, yeah. And he said, you should go to Mexico. And it was, it was kind of early in cell phone usage at the time. So he had this red phone on his desk. He picks up this old red phone and he dials Fernando Ortiz Monasterio, who fortunately picked up. And the rest is history. But that year in Mexico was incredibly impactful. It really showed me.
What did Maggie say when you said you were going to Mexico?
So she had a very good job at the time on the Hill in Washington, D.C. She was working in international trade policy, and she was very supportive.
Yeah.
I would say she was nervous about how to transition her professional life down there, but she very quickly found a route to do that.
That's great.
So we went down, we drove there from Baltimore.
Yeah.
And spent a great year.
Drove there from
Baltimore.
Baltimore.
Yeah. So I had my car down there with Maryland license tags on. So we had a great year there. Fernando Molina, Fernando Ortiz Monasterio, massive mentors. And it's funny because craniofacial at Hopkins was all about AO principles, kind of a Germanic following of doctrinal teaching. And in Mexico, it was creativity. It was how do we get the most out of sometimes limited resources, but just massive patient volume. I mean, so much so that we were operating into the evening and into the night routinely. And so I learned a lot. And the teachings were sometimes diametrically opposed to what I had learned in residency, and I was able to see there are lots of ways to skin a cat.
That's probably, you learned early, like the best type of fellowship is like complementary to what you've been doing, or to add to what you've already been trained in, as opposed to just reinforcing, what you've been doing for so long.
Yeah. I really, that's a principle I always try to keep in mind is there's not generally one right way to do things, and to keep an open mind at meetings when you're listening to other scientists present and you're thinking, oh, that doesn't make any sense. Well, let's keep an open mind. Maybe they're onto something. And by keeping that open mind, I think you learn the most.
And did you learn a lot, I'm sure, from dealing with patients who have limited resources and trying to do as much as you can with a lot less?
Yeah. And again, some of that's applicable to my practice here. Some of it's not. But I think seeing how much they're able to squeeze the juice when there's time. One for instance is oftentimes to do, like a Lafort 3 or a monoblock, the rate limiting factor was getting the halo off the prior patient.
Yeah.
And so you literally, the day before, you'd get the halo off the previous child that was treated. sterilize it overnight, and then you'd put it on the next kid the next day. So, and you think about that sort of ingenuity and how the extra dimension that they're thinking about as they treat patients in that environment. It's pretty incredible what they're able to achieve.
Yeah.
So we have to mention it now before we forget, but I've met Maggie before, and now I always think whenever I talk to somebody like you who's accomplished so much in life, that obviously they have an amazing counterpart and amazing sidekick. And truthfully, when you mentioned the fact that, she just picked up and went with you and supported that decision, we're all in life faced by inertia. It's so easy to stay put, do fellowship somewhere comfortable in the US. And clearly you did that. So kudos to Maddie and everything that she's done to support you. But anything you wanted to say on that end?
Well, certainly Maggie deserves so much credit. But it brings up another principle that I've always held dear, which is none of us gets anywhere in life without a ton of help. And I think that's an important point of view for surgeons who sometimes can forget that. And in the heat of the battle, or in the, sometimes we develop a bit of an elevated self-image. We forget, man, we don't get anywhere without so many people helping. And if you think about the path that a patient takes from your office to get into your operating room, for you to be able to be an academic surgeon and be able to be productive both clinically as well as in education and research, you need so much help. No question, you need a lot of help at home. And I don't know too many really successful surgeons who don't have more than their fair share of help at home. Brittany's obviously a huge person who's, I'm sure, done more than I will ever know for you behind the scenes. But I think it's really important, as an individual internally to occasionally remember that, but also take as many opportunities as you can to thank those around you. And whether it's the crew at home, the crew in the operating room, the crew who's helping you run your clinic, the residents, the fellows, everybody who comes together to allow you to live the life you lead, there's no limit to how many thanks that you really should be saying to be able to be a surgeon in the United States these days. And that's a real point of emphasis for me.
No, 100%. And you're absolutely right. I mean, it really does take a village to do any of this stuff.
Yeah.
So we've talked a little bit about your early years, and then now we got into Hopkins, and then you're in the midst of all the craniofacial world. We go down to Mexico City, and it seems like right now you're just an autopilot, going to do great things. Was there ever a period of self-doubt, or were you always like, okay, this is my trajectory, I'm doing it?
Oh, no. And I still have a fair amount of self-doubt. But I also think approaching everything with some amount of humility, number one. Number two, preparation. And what goes along with preparation is just being organized. But I think I still doubt much of what I do. And I say to myself, I prepare for every day before I go to bed every night. I look at what's on the calendar the next day. Sometimes I'll go 1 or 2 weeks in advance, making sure that I understand all the different things that are coming up. Because I think humility and preparation combined with, I think,
absolutely,
some amount of self-doubt, I think that's a good way to get to the very best place in life.
So you mentioned your schedule. When do you go to bed? When do you wake up?
So I go to bed at about 10 every night, and then I wake up at right at 5 every day. And then I have a pretty tight little schedule because I try to get in the car at about 5:20 to 5:25
to beat the traffic.
In. So I feed the dog, I make coffee, and then I'm in the car. I obviously shower and dress, but anyway, but I'm pretty, boom, boom, boom. And I'm in the car by like 5:20, 5:25, and then here by about 5:45 to 5:50.
You wear so many different hats, whether it's, research, academic surgeon, feeding the dog before you leave. How, like, you have to be so regimented, but how do you, if you were going to give tips to somebody who wants to squeeze as much juice out of the day as they can while still having time for family and other things that, are passions on the side, what is just some tips and advice for that?
Well, we hit on this. No, we obviously, and I don't have all the answers, guys. Believe me, I could probably take a note from you guys. But again, we've hit on this already, but I'll just say it again: build the team.
Yeah,
because you're going to always extend your ability to be impactful by having a team around you. And you build the team in all those different realms. The education team, the research team, the clinical team, and team members come and go, obviously, right? And so invest in the team members at every level. So your trainees, your fellows, we have research fellows as well as clinical fellows. Take the extra minute each day to just say thank you, to take one extra minute to say, hey, this is what I was thinking when we were in that clinic space, seeing that patient. And you're doing that.
Who taught you that? Did anyone teach you to do that? Or
it's out of self-interest, man. I'm doing that because I'm hoping the next time they see that patient, they'll go, oh yeah, he taught me this. So then the next time they see the patient before I do, they're going to come to me and go, you remember that process you told me about?
Okay, good.
And that's what's going on here.
Yeah.
So it's out of self-interest. And again, you teach the resident a technical maneuver. Mm-hmm. It's out of your hope that the next time they've got the opportunity to do that, they think to themselves and they do it the way you would have done it, because that's what that's the way you want them to help you take care for your patients. So it's out of self-interest that you spend that extra bit of time.
Can I just say something that, and I don't know the exact words, but we were in the operating room together and you told me something like, don't make the same mistake twice. And something along those lines. And I use that to this day. Yeah. With residents, I say when we're operating together, and I say, you when you make a mistake once, you learn from it, and then try not to make this. But even something like that goes such a long day. And then I remember you in one of my early years as a trainee here. I think we were doing like a forehead flap or something, but you obviously let me do a lot under supervision. And then at the end, you said, we need to find time to sit down and talk about what you want to do. Because I can tell you were just happy with how we were doing things together, and clearly I'm remembering it to this day, 7 or 8 years later. It was super impactful. So all these things that you're saying that you do, even as somebody like me, it goes such a long way. So I appreciate you doing that.
Well, I would say the other thing is I am so motivated by getting to spend time with young people.
Yeah.
And people who are still
You're
in those
still pretty young, by the way.
Well, the formative years where they're still figuring out life. And if I can be a small part of helping them figure that out, I get a lot of energy from that. Yeah. Like for me, that's the definition of fun.
Totally.
And to see, the young folks that I've been able to interact with, and then to see them, climbing through the ranks and succeeding. Man, I mean, what else? That's the spice of life. Yeah. To me, that's like the definition of fun.
Yeah, it really is.
Yeah. And I get so much energy from being on this campus.
Yeah.
And getting to do the things I
think that's a perfect time to just talk about CHOP and why it's so special.
Wait, first, I want to ask about Cincinnati children. Okay. Is that okay? I have to ask about this transition because this is something that I shared. I've actually shared this story with Brittany a couple of times. I said, they were year two into Cincinnati Children's, incredible clinical practice, very happy, house of your dreams. And then you get, which just shows you you're content. Yeah. And then you get a phone call to inquire about this job at CHOP and Penn. So tell us about what was going through your mind, this leap of faith, the phone call. And what made you actually move? And did you have any regret at the time?
Yeah. It was, and a lot of us take leaps of faith in life. And I would say this is another instance in my life where Maggie really stepped in and said, you've got to take this opportunity.
Really?
Oh, yeah. Yeah. She was like, because she at that time, before we had kids, she would go to a lot of meetings with me. Mm-hmm. And so she was starting to get a sense for the field and, what the landscape was. Sure. And, And in cleft craniofacial surgery, there's no better place to be than Penn and CHOP. And so,
But Cincinnati Children's is great.
it was a great place, yeah. But as far as opportunity to lead on the national and international level, clinical volume, in all of those areas, it would be hard to match what Penn and CHOP was at that time, and I would argue still today. And so she saw how excited I was getting about the fact that Joe and I had talked about this. And I remember there was a time when I told the folks at Cincinnati I would leave. They came back with a very generous package and counteroffer that really made me stop and think.
At that point, had you already like signed a contract?
I had not signed the contract yet with the folks here, which again, I don't want to get too into the weeds, but let's just say I was taking a very large pay cut to come here.
Yeah.
But I saw the future, I saw the opportunity, and then they came back with this even more generous package there to stay.
Back to Cincinnati, yeah.
To stay in Cincinnati. And again, it was a gut check.
And you were only 2 years in.
I was 2 years in.
So they saw something in you that clearly they wanted to keep you.
Yes. And I struggled with it.
Of course.
And but I'll tell you, again, Maggie did not struggle. She said, nope.
That's amazing.
We're going to Philadelphia. This is clearly and she was absolutely right. And, anytime you go from big practice, fair amount of success to I'm going to start fresh at a new practice, new location. And by the way, I was going from being a big fish in a smaller pond to being a really small fish in a big pond here. There were times when I was like, wow, what did I just do?
And it sounds like you weren't even looking. They kind of called you, right? Or were you kind of
I wasn't actively looking, but I was certainly at the time starting to see what the sort of where I might max out there, and starting to think to myself, is this... And, it's interesting. One of the things that I didn't feel in Cincinnati to the degree I felt in Baltimore and to the degree I feel here is that big academic feel where everyone is so jazzed about learning and being together and mentorship and lab and this and that. So, I mean, there's something very, very special that when you are here, you forget sometimes how special this is because you've been here for 15, 20 years. You're like, it's kind of part of you. This is so special what we have here, and we shouldn't take it for granted. The culture of everybody coming to work, wanting to be as good as they can be. I'm talking about from the person who's, cleaning the place to the person who's the, physician in chief, et cetera. Everybody's coming to work wanting to be the best person they can be. All of the components here are just very, very special. I don't know how better to put it, but that vibrancy that exists in a place like this because of that it's just very special.
We touched on it briefly in the beginning when we opened, but I formally want to congratulate you again on becoming surgeon chief and the chair of surgery here at CHOP. What does that mean to you, especially at a place like CHOP? We were just talking about it, but was that something that you've always wanted to do when you heard that there was a position possibly? Did you start thinking about it, or how did that come to be?
Yeah, so I would say, did I have my sights set on this exact job? No. But the opportunity to lead and to specifically lead this group of people at this institution is a huge, huge honor for me. And
did you always see yourself as this sort of leader? Like, I want to be a chief or a chair?
I wouldn't say that I did. No, I think that I've done a fair amount of leadership training over time in different phases of life. From the time I was a kid to now, I think I've read books about leadership. I've been interested in leadership. I've thought, and I've probably taken an extra moment here or there to kind of observe leaders and how they behave and what are some of the secret sauces, et cetera. But I didn't have my eye on this particular job. But being in Philadelphia, seeing the incredible stuff going on at Penn and at CHOP, and in thinking to myself, boy, the culture that's been created here is very special. How can I be a part of this to the maximum degree possible? Is something that as again, Scott Adzick, my mentor, was getting ready to step down, and having developed a pretty significant relationship with him, and having worked very closely, I would say, with him on a number of different levels, he said, listen, I hope you'll think about applying for this job when I step down. And as I thought about that, what I saw in myself and what he was seeing in me, I thought, yeah, it's time to think about something like this.
What are the specifics of this job that kind of get you energized, as you were talking about earlier? And then what are some of the things that you unfortunately, to take on this bigger role, that you kind of have to give up or slow down on a little bit, that make you not as happy?
Yeah, so one really amazing thing about this role is the ability to lead the surgical group at CHOP, which is it's an incredibly special group of people. The other amazing thing about this role is you can continue to practice clinical medicine to a pretty significant degree, which really is something that I wasn't ready to give up clinical medicine. There are some chair positions where it's very difficult to be active clinically. And so if this had been a job where they said, look, you can't practice clinical medicine, I actually would not have applied for it. So those two things, being able to lead this group of people and still have a pretty active clinical practice of cleft and craniofacial surgery. Yeah. And then again, get to do it at this place. And some of the things about this place that mean a lot to me are the culture that's been built over decades. And, before we started talking about Everett Koop and then Jim O'Neill and then Scott Adzick, these are folks who all have pride of ownership, are team players, and have built incredible teams of people to help care for the most complex of illnesses in kids. This is a place that has a real spirit of entrepreneurship, such that there are lots of firsts that have happened in the Department of Surgery at CHOP. So to be able to be a part of that. And, I think there are a lot of places, if you look down Civic Center Boulevard here, you really see some of the earliest human applications of precision medicine and gene therapy in kids and in adults, going back to the 1990s, with Steve Raper and that group. They were one of the very earliest groups to do gene therapy. So again, this is a very, very special place to be able to innovate in a safe way, obviously, but innovate, practice medicine in a very team-oriented way, and not have to give up practicing medicine if you take on major leadership roles.
Yeah. But having to probably decrease a little bit of the scope of your practice or the volume potentially?
Yeah, so the way I'm doing it right now is 50-50. So 50% clinical and then 50% administrative. So I'm in that phase right now where I'm trying to do everything a little bit more than 50-50, but I'm definitely working towards sort of a 50-50 split.
So from the viewpoint as the new surgeon-in-chief at CHOP, what do you see as the potential challenges for pediatric surgery, plastic surgery in the coming years ahead of us?
Yeah, and again, at a place like CHOP, I think you should be saying not just what are the challenges, but like, how can we truly change the trajectory of pediatric healthcare? It's such a well-resourced place, and we have so many groups of people doing research. You should be saying to yourself, what are 5 or 10 pediatric illnesses that have plagued mankind for millennia, and how can we stop them in their tracks? How can we figure out what causes cleft lip and palate and cure it? What about craniosynostosis? What about osteogenesis imperfecta, Hirschsprung's disease, other neurodevelopmental problems that potentially are single gene or gene editing type things that you could bring precision medicine to? So as I've come into this role, one of the things I'm thinking is, what are some really daunting and big challenges that we could potentially make disappear from the face of the earth. And that's what I'm thinking about as I meet with my colleagues at CHOP. And I hope that, we won't be able to knock all of those out of the park, but how can we get, a pretty significant distance down the road to maybe curing some of these things?
And I think to myself, as kind of like an outsider looking in from the Penn viewpoint, seeing how much you did, I got to Penn in 2018, but seeing how much you did to the division as your time as the chief of the division of plastic surgery, in your recruitment, and not only in your recruitment, but also in your mentorship of people like Jordan Swanson and countless others, your recruitment now of Cassie and Samir. And you think back to the time when Dr. Bartlett was the chief, and he did an amazing job, built this incredible reputation in pediatric plastic surgery. And you see how change, even with you, brings all these new ideas, new recruitment, et cetera, and the recruitment of Dr. Liao and all the NIH funding. And so it's really a natural skill set for you, clearly, to formulate an impressive and powerful team like you have done. But when you think about leaders and academicians, is it something that's born? Is it innate? Is it like effortless for you? Or do you constantly think, this is my team, this is what I have to do? I need to have NIH funding. I need to have a lot of surgeons that want to operate. What does it make to be a good leader?
Yeah, I think that there probably are some things that are more innate to people than they might be to others. But I think a lot of this is learning from others, reading about it. So it's like trying to get good at anything. The more you practice it, the more you flex those muscles, the better you're going to be at it. And I think to be interested in leadership as a topic, and study leadership, read literature related to leadership, certainly helps one be the best leader they can be. And I've spent a lot of time studying leadership and learning about it. So I don't think it's necessarily innate. And I think I'm still learning. I mean, do I think I'm a great leader? No, I think I'm getting there, but I've got a long ways to go.
Yeah, I think you're a great leader.
Yes.
I've got a long way to go, guys.
Yeah.
Trust me.
One thing that I love asking people, especially on this podcast, and we've had some interesting responses to this, but like, if you could go back and talk to your younger self at any point in that person's life, about to start residency, about to make the move to Mexico, whatever that may be, do you have any advice for them or any regrets perhaps along the way?
Believe in yourself. Sometimes, and I think that's another role that mentors serve, is helping young people believe in themselves before maybe they see it in themselves. Yeah. I think a lot of people, and I was one of them, suffer from maybe a little too much humility, and you think to yourself, I could never compete on that level. And to have mentors say to you when you're young and impressionable, no, just swing for the fences. You can do this. Mm-hmm. You've got what it takes, means a lot to young people. And again, that's something I try to keep in mind, is to...
Who is telling you to do that?
I mean, I think a lot of mentors did, No, certainly when I was a young boy, my parents. When I was in college, college professors who saw me working hard and thought, hey, this person could potentially do something cool. But throughout life, to have people who occasionally took an extra moment and said to me, no, you can compete on whatever level you want to compete on, and don't be afraid to do that. I think that's such a powerful thing for a mentor to do, because all of us, again, carry around some amount of self-doubt, right?
Absolutely.
And so I think that's another role that a mentor can play. So I think have some level of confidence that you actually do have a skill set that's useful to people. Don't be afraid to take some chances in life. And I think in general, I've taken some chances. We talked about Cincinnati Children's to CHOP transition. But again, those are chances predicated on knowledge of who I am and what my skill set is. And so it's kind of like, I don't just make guesses, I make hypotheses. So it's an educated guess, not just a guess. Mm-hmm. And so, I think don't be afraid to take an occasional chance. I think another big thing that I really try to do is be honest with myself about who I am and my shortcomings. By doing that, and by being willing to fail or being willing to see yourself as imperfect, it gives you the grace and the space to then try to make yourself better.
Yeah.
And so I think that is a really important, again, just kind of life outlook.
Yeah. And I think, one of the things that I admire too, which you haven't mentioned, so I can mention it, is the hard work. And I think if your name comes up, along with all the other positive things that we all say about you, I think one thing that everyone will agree upon is how hard you work, which is great. And it goes back to you talking about your dad and how hard he worked, and that, this may not come easy. Some of it may come naturally, but you have to put in the effort. I mean, do you want to speak to that?
Yeah.
You're a very hard worker.
Well, I believe in, again, meritocracy and the value of hard work. And so again, if you want others to help you, you've got to help them, and lead by example really is what I'm trying to show there. Is when I'm coming in early and trying to be the first guy into the office, it's trying to show everyone else, hey, I'm not going to hold myself to a different standard than I hold you. I'm going to hold us all to the same standard. The other thing is, to do something special in this world is always going to require some amount of dedication that's beyond sort of 9 to 5. And so whether it's creating space in the evenings to read about something new, learn about something new, or in the morning coming in a little bit earlier than you need to get here in order to give yourself a little bit of space to maybe read an article that's fun for you before you start to get into what can sometimes be, the more sort of rote part of our jobs. Creating space for that intellectual capacity to show itself in the day is something that I think is a key thing I try to always remind myself. Whenever I feel myself getting burned out a little bit at work, I say to myself, you just need to read more. And so I try to then keep PRS or some other journal on my bedside table or on my office desk, and I'll tell you, it is the cure for burnout.
That's great.
You just got to learn about the incredible stuff that others are doing, and then you're energized again.
Yeah.
And there's so many exciting parts of surgery right now. But one other thing that I didn't say when you were asking about CHOP surgery that I really believe is, to date, we've really defined ourselves in surgery at CHOP by the level of complexity and challenge that the surgeries that we do have presented to our patients. But I think in the future, we will be as well known for the surgeries we don't do as the ones we do, meaning treating disease with precision therapy, medicine instead of surgery. And I think surgeons don't always have that point of view. They're cutting and sewing. But I think academic surgeons need to always be thinking, how are we going to innovate such that there are certain things we don't have to cut and sew in order to cure?
Yeah. Interesting. No, I think that that's a really good point. And that's something that I always look forward to, especially with some of Dr. Liao's work. I look forward to the future and seeing how that might change, and alongside AI perhaps taking over some of these other positions.
Yeah. There's no question AI is going to play an increasing role in all of our lives. And again, let's embrace that.
Yeah.
And let's learn how to use that tool to the betterment of ourselves, our patients, our families.
Totally. I think before we dive into some of the fun last sort of rapid fire personal questions, you've held a number of leadership roles, both in both national and international societies, also American Board of Plastic Surgery. Is there anything we didn't touch upon today that you wanted to just mention reflective of all of those leadership positions in societies?
Well, I get a lot of energy also by going and having intellectual discourse with disparate groups of people, which is essentially what you're doing when you involve yourself in national and international groups. The International Society of Craniofacial Surgery, I mean, I've learned so much from my colleagues at the ISCFS. The American Board of Plastic Surgery has really allowed me to flex a different muscle, which is the ethical muscle, and how do we best train the next generation? How do we make sure that plastic surgery is being practiced in its most ethical way in this country, which has been a really great muscle to flex over the last several years, and one that I take super seriously. And then I think the third sort of group that I've really gone deep with is the journal Plastic and Reconstructive Surgery, becoming a section editor of the cleft and pediatric sections. Again, anytime I get burned out, I call up Sam Lin and say, give me some more PRS reviews, because I get so much energy from seeing the really cool stuff that folks are doing around the world.
Yeah.
Yeah.
So with all of this stuff, you mentioned things that would occupy beyond 24 hours in a day, right? What do you do outside of work that kind of keeps you grounded?
So I still try to stay in shape and take care of myself. I play some racket sports, tennis, padel, a couple different ones. I've got a little knee injury I'm having to rehab right now, so I'm a little bit backing off from the racket sports. I play golf a bit. I'm now swimming a fair amount, because I've always been a big runner, and running is a place that I really kind of cleanse my mind, and I get kind of into a little bit of a zone. But I can't do that because of my knee right now, so I'm swimming instead. So I think it's really important to stay in shape. I spend a lot of time with my family as much as I can. I get so much energy from my kids, Betsy and George, and from my wife, Maggie. And then I stay in touch with my brothers and my parents and other family members. I think connecting with community is another way to keep yourself mentally healthy.
Yeah.
You were saying that your mom was a musician and you grew up playing some music. Do you still play any music, or what instrument did you play?
I grew up as a violinist, and I played in orchestras my entire childhood, including in college. I played in the Rockbridge Symphony Orchestra in Virginia.
Yeah, amazing.
When I was an undergraduate.
You played tennis in undergrad too? Or no?
Yeah, I played tennis. Yeah. Played tennis. I played soccer for a year too as an undergrad. So I guess I've always maybe been a little more regimented than some other folks and a little less free-flowing, but so I don't know, maybe I'm a joiner. I like joining things and being part of groups.
Yeah. One other thing that I actually should have asked earlier, but I think it's important for our listeners to hear, because we have, undergrad, medical students, trainees, faculty. We have a broad range of people outside of medicine listening, outside of plastic surgery even, who I think it would just be important to hear, because we have such a wide range of guests, just we know obviously, but the uniqueness of pediatric plastic surgery. Plastic surgery is unique in the sense that the patients are seeing what we're doing on the outside as well as what we need to do on the inside. But dealing with parents and young kids and that unique aspect, if you could just talk a little bit about that and why that's so special, more difficult, and the challenges of that.
Yeah, so
you're treating the parents in some.
Exactly.
Yeah, so it's
And
really
being a
developing
parent,
a relationship with an entire family, not just an individual, which I love. I mean, to me, that's as I mature in my practice, it's always been something I've enjoyed, but it's actually that part of my practice I enjoy even more now than I did when I was a young surgeon. Getting to watch kids grow up, getting to have a relationship with a family and parents over a longitudinal period of time. It's just something I've really enjoyed. And we get to know each other as human beings. We get to watch each other gain gray hair over time, et cetera. And but that's a very special relationship. And dare I use the word sacred? It's a sacred relationship, and is one of the most meaningful parts of my career. The other part of pediatric plastic surgery that I find incredibly compelling is just the technical aspect of the surgery. There's a lot of really cool bone carpentry and biology inherent to growing bone. The soft tissue work of that, really some intricate anatomy in the face, be it the lip, the nose, the periorbital region. Those are highly unique anatomical regions that require a lot of attention to detail and care. And if you're off by a millimeter, people notice it. So that sort of highly technical aspect of it is something that drew me to it as well.
Yeah. What legacy do you want to leave behind? Not like you're leaving it behind anytime soon, but
put me in the ground. Probably pretty basic stuff. I want people to say he left the place better than he found it. I hope I can have some sort of positive impact on young people's lives where they'll pay it forward to the next generation. And so it's the virtuous cycle of everybody's trying to help the next group of people elevate their game to the greatest extent possible. I mean, I would love to have there be some sort of scientific discovery that outlasts my useful years on this planet.
That'd be cool.
Who knows if I'll ever do that. Those are probably the big things.
Yeah. You got to do a rapid fire?
Yeah. So we asked them probably when we first started, but we're going to do them again.
Okay.
What music do you listen to in the OR, and what's your favorite surgical instrument?
Music in the OR is often old school hip hop and R&B, often from the 90s. Favorite instrument is the Molt periosteal elevator.
I could have guessed that.
Referred to as the number 9 here at CHOP.
Yeah. Well, this has been kind of on our to-do list for a really, really long time. But what I love most about this is getting to hear all these background stories. And it's really, just like you said, you go through different aspects of your life. When I go to a conference, I get energized. Really, when we have these podcasts is where I get energized. So Thank you so much.
I get energized listening to your podcast. So keep it up, guys. Keep it up.
Yeah. No, but we really enjoyed today and learned a lot. So thank you so much. And congratulations on your new role.
Thank you so much, guys. Thanks for having me.
Thank you for listening to The DIEP End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The DIEP End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.